Hi everyone, and welcome to ALHT 209, which is our laboratory testing class. My name is Melissa Shepard, and I'm your instructor. Just a little background on me. I was a medical laboratory technologist for many years in a hospital setting for the main part of my career. I also worked in some clinics and outpatient labs. But later on, I bought a durable medical equipment company, and I ran that for several years before deciding to go back to school and pursue my master's in public health. First, I received my bachelor's in community health and then my master's in public health. I've been teaching at BIPSI for a few years now, and I love what I do. I see teaching at the community college level as a part of public health. So again, like I said, I love what I do. I love my students, and I do everything I can to make sure that you guys will be successful. So the two things that I would like you to print out when you go to the start screen on Canvas to get started here, we're doing things a little different right now. So what you will do is just print out the reviews for chapter 1. There's 17 reviews there for the chapter, but with limited access to the ability to print for students during this time with COVID, if this wasn't during that time, we would get you to print it out yourself and put it in your black binder that I'll go over with you about that. But right now I'm going to have all that stuff printed out for you because the beauty of this class is the lecture is online and the lab is in person for the most part. There will be some times that you will not be on in lab class like we normally do. But so I do have access to hand out things to you. So what I will do is on that first Monday when you're actually in lab class, I will hand out all your other chapter reviews, you'll have 1 through 17. But if you want to go ahead and print out chapter review 1 and get started before you see me in lab, you're welcome to do so, and print out a copy of your syllabus before you see me in lab. Please do so. They're both on Canvas. And then you will have access to all 17 chapters on Canvas at any time, but we will hand those out to you on the first day of class. So let's get started. Okay, so looking at your syllabus, and when you watch this video, some things you might want to have with you, especially with this one, would be a copy of your syllabus, so you can kind of look through your syllabus while I'm talking to you, and your first chapter review. So like I said, if you can, or if you watch this prior to coming to your first day of lab, go ahead and print out chapter 1's review so I have it with you while you're watching this video. And then what you're going to do is, once you have all copies of your 17 chapters, you yourself will buy a 1-inch black binder, some dividers and tabs, and then you will take all those chapters, which will have holes printed in them for you, and you will place them in your black binder, and you will put your dividers from each chapter, divide everything out, and tab everything, okay? You'll also have a laboratory testing workbook, and then there's 2 books. There's the laboratory and diagnostic testing and ambulatory care. There's 2 of them. There's a textbook and a workbook. So in the workbook, you're going to tear out the pages that corresponds with each chapter. They already have holes in them. You will place them behind the chapters that I give you. So I'm going to give you chapter 1 reviews, okay? And then behind that, you're going to put those pages from your laboratory testing book. Learning is all about repetition. Once you do things over and over again, you learn it better, it gets burned into your memory better, you become more effective at it. So that's why a lot of this is duplicate work. A lot of those laboratory testing worksheets you will do at home as homework. So the more you do that stuff, the better you'll get at it, okay? And so you can also use Post-it tabs, any types of tabs you want. Just write the number of the chapter or other labels for assignments, because there'll be other things that I hand out to you, and you will just tab those assignments as needed. And you want to keep all your chapters in order. because we want to be as organized as we can. You will find in healthcare, things move quickly. If you're in a doctor's office, you want to make sure that you're as organized as humanly possible. You can find things quickly. We want to start teaching you to do this now in class so that when you go to work, you'll always have that foundation of being very organized and having things in order so you can find them quickly, okay? So the first thing we're going to do is I'll have a discussion section up in Canvas. Okay, and you're going to write a personal essay. It'll just be a paragraph or two, and I want you to tell me and your rest of your students, rest of your classmates about yourself. Okay, and you will get bonus points, and this will count towards attendance on that first day. So you do have to log in on that first day, which for lecture would be that Wednesday, and you would make sure that you complete this. So write that paragraph or two about yourself, and then at some point, and you'll have directions on when this is due, I would like you to at least respond to another classmate. So not only will you get bonus points for doing this, but it lets myself and your classmates know a little bit about yourself, but also you get bonus points for that. Now, I also give bonus points for finding my office, but due to COVID, we're not going to be able to locate that office. But there will be a lot of information on the syllabus that we go over on my office hours, ways that you can contact me, all the ways that we can have meetings. So I want you to write up a little something about that, and I'll have a place for you to turn that in, and you'll get bonus points for that. You also get bonus points for your picture on Canvas. It needs to be a face shot. I can see you clearly. And you will read chapters 1 and 2 in your laboratory testing textbook. And then you will fill out the chapter reviews that I give you in class. And then when we have our very first test, you will turn all that in for a grade. So you will turn in your black binder, and your grade is based on, do you have your chapters in order? Are they tabbed? Is everything tabbed and in order? You will also, did you fill out your chapter reviews completely? Did you work on your workbook pages at home? So these are the things you'll be tested on. And again, like I said, you'll be completing chapters 1 and 2 in that laboratory testing workbook pages. Those workbook pages are considered take-home tests, due the first day of the test, right? Now, it's your responsibility to look at your syllabus for your homework assignment and do them, even if I don't talk about it. Because you guys, you can go through your syllabus. There's a tentative course calendar attached. So let's just say that you see the microscope skills test, which on page 6, you'll see that about mid-page, and it says microscope skills test. It's worth 30 points. If you move your hand over, you'll see the date that that is due. Make sure that you use this tentative course calendar and your alerts on Canvas and your weekly assignments on Canvas to keep you on track. Stay ahead. Make sure that you look at this syllabus and know when your assignments are due. So these are the 2 textbooks that you'll have. At the top, that's your textbook. You can either get the older or new edition. Both will do. If your book looks like either one of these are fine. And it comes with a textbook and a workbook. And then I will give you a white binder the first day of lab that's your lab binder that goes along with these. So you're responsible for getting your textbooks, and they can look like either one of these. There's 2 of them, the workbook and the textbook, and then I will hand out your white lab binder the first day of lab. So remember, when we're in lab, you must be polite. Try not to talk when I'm talking. You need to silence your cell phones and do not take classes or text during class. There'll be no eating or drinking in the classroom, and we will have a litany of rules while we're in that classroom, dealing with face mask, other personal protective equipment, hand sanitation, and sanitizing your work areas before and after you're in the classroom. So we'll go over all this in lab. So remember some announcements. CPR, you must recertify if your CPR card will expire before or during your clinicals, okay? If you are interested in an Associates of Science degree, make sure you see your advisor, Ms. Mullins, Ms. Winter, someone to talk to you about finishing up your associate's degree. If you have a lot of extra college hours, You may be very close and only need a few classes to finish this up, okay, if that's something you're looking at. Okay, MA students, are you currently in or have you already taken Allied Health 203 and or Allied Health 201? If not, you need to see Ms. Winter immediately. So moving on to the syllabus, if you'll look at page 1, and hopefully we have these page numbers right inside this PowerPoint. If not, I'll talk to you about this now. Yes, you'll notice at the top of the syllabus, it shows my name, then it shows my email address, and my office number, also my office telephone number, my cell number, and all my information on my virtual office hours. Now, you can text me at any time, and I've usually before 4 o'clock in the afternoon, 7 days a week, I'll usually check that and get back to you that day. So that's really the best way to reach me. But you're welcome to call during my office hours. Also, I'm always available during my office hours. We can do it by text. We can do it by phone. I'll be checking my email during my office hours, so you're welcome to email me. We can set up a video conference. So there's lots of ways. And remember, you get bonus points for writing up all the ways you can get in touch with me, okay? So your grades are on there. If you look on page 1, it has assignments, possible points for those, and a percentage of the total grade, okay? So lecture and lab makeups. You cannot make up a lecture test without a doctor's excuse, okay? Lab test as well. Your lecture test, all of those will be given online, and they will be open. There will be a due date. So in other words, the test may open on that Monday, but you don't have to finish taking it until midnight on that Wednesday. So you have all 3 of those days to be able to open up that test and take it. So that's why we're going to limit. It's going to be hard to get a makeup on that. And it needs to be a written doctor's note that you were sick for multiple days during that time. Because you will have all this stuff online ahead of time. You will know when your tests are. You will know what to study. So there's no reason you will not be prepared. And so you need to make sure you're on top of this, on top of your reading, on top of filling out your review guides, because your test comes directly from those. Okay? So once you open the test, you're open. You can't pause it and go back to it at a later date. The test will be timed. And once you open it, that's it. You have to take it and you have to finish it in the allotted time. But you will have multiple days in which you can get started on it. So if you have something going on that Wednesday, even though that should be your dedicated time for this class, you can prepare and take it on that Tuesday. Okay? Lab worksheet makeups. All labs must be done to pass this class. And all labs must be completed. Do not miss lab class. Due to COVID-19, we're going to lab 1 day. Okay? We have a little bit extended time, but we are really limited. So you must complete all those lab worksheets. Do not miss. Okay? And you will not have a chance to make up those labs first without a doctor's excuse. And we just don't want to run out of time on this stuff, guys. So please, please don't miss those labs. So you will have information on your research paper. Directions are going to be on Canvas. This is all your stuff on your absence. I'm not going to read all this stuff to you. There's your last day to drop. Okay. The tardiness and stuff is dealing with the face-to-face classes we have in lab. But make sure you read over these things. You can pause these videos. Now, to make sure these videos don't take forever, all the information you need to fill out your review guide, all the information you need to contact me, everything will be provided to you in your syllabus, tentative course calendar, on Canvas, and on these PowerPoints. I am not going to sit here and read line by line these PowerPoints for you, but I will go over anything that I need to go over to make sure that you understand. And then if you have any questions, comments, or concerns, you can reach out to me by the multiple ways that you can get in touch with me to ask questions if you need clarification on anything. So again, your tentative course calendar. Remember, you find what it is, whether it's your microscope skills test or any take-home testing on charting, and when it's due, you move your hand back over to the left-hand column. It's going to tell you the date those are due. Get to know this tentative course calendar. Go over it, read it, make notes on it, highlight it, circle the things that you know. So pause this video and go over each one of these things, get your tentative course calendar and find them and make sure you know what they are. So, like I said, I love what I do. I will try to make this class as user-friendly as humanly possible, okay? I always keep my office hours. I make myself available to you outside my office hours, and you can reach me by my cell phone. I don't put anything on my test that are not on those chapter outlines, key terms, and abbreviations for each chapter. There will only be 1 to 2 chapters on each test. So if you read the 2 chapters in your textbook, if you watch your PowerPoints and fill out your chapter outlines, you know your key terms and abbreviations, you will have no problems making an A on this test. Okay? I will give you the answers to the chapter outlines in lecture on these PowerPoints. I'm not going to read verbatim, line for line, every line on these PowerPoints. I will hit the high spots so that you will know the important stuff. Everything you need for that test is in those chapter outlines. All the answers to the questions on the chapter outlines are in these PowerPoints. So all you have to do is watch the PowerPoints, fill out your chapter outlines, read your chapters in your textbook, and study your chapter outlines, and you will be successful in this class. So chapter 1 is Introduction to Laboratory and Safety Training. So these are some videos. You can copy these links and put them into your browser. If you have any difficulty with that, reach out to me and I will help you with that. But this is talking about what is a medical assistant and what is a laboratory assistant. Because all the people that will be in this class will either be people that are already phlebotomists that are now getting certifications to be a laboratory assistant, or they're in the process of finishing up their phlebotomy and they're taking this class as well. So they will have both their certification in phlebotomy and their certification in laboratory assistant, or you are a medical assistant and this class is required for you, okay? So these are your learning objectives. I'm not going to read them to you one at a time, but these are the things that you will know once you finish chapter 1. Everything from listing the reasons that laboratory tests are ordered and describe how specimens can be analyzed, down to identifying and use of laboratory requisitions and reports with proper documentation and confidentiality. Your learning objectives are also listed in your textbook. Here are the rest of your learning objectives, including the things that MARB requires, like identifying safety signs, symbols, and labels. Okay, and we will describe the proper actions to be taken after an exposure. Okay, you'll be able to list and explain the safety rules that must be observed in the laboratory, and as we all know right now, this hits home, and we will follow every one of these safety guidelines to a T when we are face-to-face in our lab. You will also be able to list and describe 3 analytical phases of laboratory testing requiring quality assessment. So you want to review some of the key terms and abbreviations. Don't forget, study all the key terms and abbreviations for the test. Start studying these now, because it takes time for us to go over this stuff over and over so we can lock it into our mind. And not only can we memorize it, but we understand it and we know what it means, right? So I'm not going to read each one of these, okay? I'm going to click through these, but you guys can pause these, fill out your review guides, and then study your review guides, because that's what your test is going to be on, okay? So I'm going to click through these each one at a time slowly, but you guys can pause this video. That's the wonderful thing about this online class, is you can pause this, then fill out your review guide, read your chapter, study those, and you'll make an A. So what is another name for an outpatient facility? Ambulatory testing, right? So here we go. An ambulatory setting, I'm sorry. An ambulatory setting is what is another name for an outpatient facility. You need to know all these key terms for your upcoming test. So what is a disease spread within a healthcare facility? This is very important because one of our jobs is to make sure that we keep our patients safe, their families safe, ourselves safe, and our co-workers safe. So this is a very big deal. We want to make sure that we break that chain of infection and stop the spread of infection inside a healthcare facility. So what is a disease spread within a healthcare facility? It's a nosocomial infection, correct? Okay, guys, make sure you pause this as needed. Start studying it. You can use this part of this slide to test yourself, to see if you're getting these answers correctly. So we're going to move through the rest of these questions. Make sure you're filling out your review guides. And remember, when it comes to coagulation later on, we'll talk about all the things having to do with drawing blood. And a lot of our tubes will have additives in them. And one of the additives that will be in some of the tubes is an anticoagulant. So what is the clotting ability of the blood called? The blood can clot, and it's called coagulation. So as you learned in medical terminology, anticoagulation would be stopping that process from happening. And we'll learn about anticoagulants that are in tubes so that when we draw patients' blood, it will not clot. So there'll be some tubes that don't have an anticoagulant in them and they will clot, and there's some tubes that will have an anticoagulant in them and they will not clot. Okay, these are some critical thinking and higher learning activities. These are just ways that we can go over this information over and over again so that you will not only be able to memorize it, because we don't want to just memorize things. Some things have to be put to memory. But the key thing with that is if you use it over and over again, like the order of draw and what a CBC goes in a purple top tube. These are the things that when you're out there working and you're doing these things day in and day out over and over again, they will just become very simple to you. You will understand it, and it helps with that memorization part of it. But I also want to make sure you guys understand the process. Like, why do we draw a CBC in a purple top tube? Why would we do that? Because a purple top tube has an anticoagulant in it, EDTA, right? And so earlier when we talked about stopping that coagulation process, if we want to see those cells or we want to count the cells, we would not want to allow them to clot, because then it would all clot up in a big mass and we wouldn't be able to run them through the instrument and count our red cells and our white cells and our platelets. Right? So we want to not only know that a CBC is drawn in a purple top tube and it has an additive and it's EDTA, but we want to understand why we use that for a CBC, okay? So these slides help you not only memorize, but understand. And remember, they're designed to help you remember new information and think critically. Sorry about the interruption, guys. Okay, so this won't be a test, right? This is just ways to make you, help you understand this information and help you put it together in a scenario you may actually face when you're out working as a medical assistant or a laboratory assistant. So look at these. You can pause it before the answer comes up and see if you're starting to put this information all together. So, fundamental concepts overview of laboratory, okay? This class is designed to help you understand and learn about running lab tests in a doctor's office as a medical assistant or in a hospital as a laboratory assistant. So what are some things you already know about lab tests? Who orders them? Who performs them? What kind of tests do you already know about? And what are some types of samples used for running lab tests? So, the purpose of medical laboratories. Why are laboratory tests ordered, right? We want to screen patients for possible disorders, right? Then it helps us to establish a diagnosis with other things like vital signs in patients' histories and other diagnostic tests like x-rays and MRIs. And we also use lab results to monitor the patient's condition or treatment. So if we're treating them with a medication to lower their blood sugar, we want to be able to check their blood sugar to make sure it's staying within range and that medicine is actually working, to see if we may need to up our dose or lower our dose, right? So here's one of our critical thinking slides, okay? I'm not going to go read every one of these for you, but we'll start off with the first one, okay? So Mrs. Smith presented to her physicians complaining of a runny nose, sore throat, high fever, and muscle aches. The physician ordered a rapid flu test. For what purpose would the doctor be using the medical laboratory in this case? Are we screening the patient for a possible disorder? Are we using it to establish a diagnosis, or are we using it to monitor the patient's condition or treatment? You're using it to establish a diagnosis. You feel like this patient has the flu from their symptoms. Typically, Ms. Smith's going to be in there in that doctor's office during flu season. They're seeing lots of patients come in with these symptoms, lots of patients testing positive for the flu. So we're just trying to establish a diagnosis that Mrs. Smith has the flu, right? So what are 3 general ways to analyze a specimen? Measure levels of an analyte and compare it to the reference value. So you run the glucose and you see if that glucose is within normal range. You observe and detect abnormal cells under a microscope. You see that this patient has sickle cell, or you see that this patient has more neutrophils, more monocytes, whatever it may be, that helps you and helps the physician figure out what's going on with the patient, or you're detecting the presence of a pathogenic microorganism. If you do a strep test, or if you do some other test that tells you the patient has the flu, or if you do some other thing that will tell you the patient has staph, things of this nature. Okay, read over this slide and then pause it and see if you can answer each one of these questions. So we're just going to run through this. So types of medical laboratories and personnel. You want to name and describe 3 types of medical labs: reference, hospital, and ambulatory care labs. Make sure you pause this and read over these so you'll know which each one of these is and fill out your review forms. Make sure you pause it and go through this slide so you can kind of get an idea of a clinical laboratory and how the order of this goes. Who works in each department. So still staying on that types of medical laboratories and personnel, we're talking about name the function of each 7 departments of a reference lab. So you have specimen collection, the hematology department, the chemistry department. Pause this, make sure you understand each one of these, and fill out your review guides. You have immunology and serology and immunohematology, the microbiology department, the toxicology department, and the pathology department. Okay, now we're moving on to talking about point of care testing. Testing of a patient in a hospital at their bedside. We see a lot of this where a phlebotomist, a medical assistant, a lab assistant may go into that patient's room, stick their finger, and right there at the bedside be able to see what their glucose results are at that point of time. But point of care testing is done in patients' homes by themselves or by a healthcare professional, in physician office labs, at POL, in nursing homes, and at the bedside. So here's another one of our slides. So make sure that you pause this, read each one of these scenarios, because what we're trying to see is if you're taking this information and you will be able to apply it when you're out there working, which is very critical. Okay, so CLIA wave test, okay? So the level of test usually run in POLs. These tests provide simple results with minimal amount of interpretation. Now, what does that mean? CLIA, and we'll go over this, but CLIA is a law. CLIA is the laws and the rules and regulations that any lab that is testing human specimen has to abide by. If you do not abide by these CLIA laws, you can be shut down. So most physicians' office labs, run what is referred to as waived testing. Okay, so as a laboratory assistant or a medical assistant, you will have the training needed to run these wave tests. So here is some common CLIA waived. They're very user-friendly tests. and they're usually performed in physician office labs. And we'll talk about dipstick, hemoglobin and hematocrit and sedimentation rates, some coagulation tests like a PT or prothrombin, some chemistry tests like glucose and cholesterol, and the other ones that's listed on here, some immunology and serology tests like pregnancy testing and mono test, and then some microbiology testing like strep A, Lyme disease, and influenza for A and B. And then there's fecal occult blood testing. And a lot of these tests we are actually going to be running in the lab when you're in there at our face-to-face lab. But make sure you're filling out all that key information on your review slide, on your review chapter reviews, so that you can study those, because these are the things, the questions that will be on your test. Make sure you're pausing these before the answer pops up so you can see if you're learning this stuff, and you will know what you need to study more. So this is talking about naming 4 healthcare workers or staff who staff a physician's office. These are some definitions. Make sure that you'll be able to define these. So go through and use these slides as we pop through them one by one to fill out your review guide. You can pause your video and fill out your review guides. So now this is talking about 8 attributes of a laboratory professional. You're now going to school to be a healthcare professional. And we always want to make sure as a healthcare professional that we're always honest. Because if we do something wrong, no one likes to admit we've done something wrong, but you have to be honest. So you always want to be honest. You want to be discreet and keep confidentiality. You want to be respectful and provide great customer service and care to your patient. You always want to be in the proper attire. You want to have good interpersonal communication skills with not just your patients, but your coworkers. You need to have that manual dexterity and good eyesight and normal color vision to be able to record results and do your job. You want to be observant, motivate, organized. You want to be a problem solver, and you want to be precise in your calculations and always be neat and clean. So talking about laboratory documentation, if you don't write it down, it did not happen. It's very important to make sure you document everything. So some forms of, some reports we have requisitions, right? This is the physician's order for laboratory tests. Some of them may be handwritten requisitions that are given to you. Some may be a printed out requisition with things that you can peel off and put in logs and on your specimens. But you will have a requisition that details to you what the doctor ordered. This is the link to the insurance company and consulting physicians. Sometimes it'll give you specimen collection requirements. Sometimes it will, sometimes it won't. It is important that we understand what specimens need to be warmed, which ones need to be chilled, which ones need to protect it from light. Sometimes these requisitions will tell us, but we need to make sure we know this and understand it, because some won't, okay? You'll have your patient information on there and any kind of profile or panel ordered for the specific purpose. Okay, profiles and panels are a good way for doctors to group bunches of tests together to try to figure out what may be wrong with our patient, right? Like an electrolyte panel, a chemistry panel, a renal panel, liver panel, right? Here's an example of our requisition slip. This is one example of many. Depending on where you go to work, you will see different kinds. So still staying on laboratory requisitions and laboratory reports, then you have laboratory report forms. This is where your results are for each one of the tests that's ordered, and that will end up on the patient's chart. And results must be reviewed, signed, and dated by the physician, and then they're filed on that patient's charts. So what if we get an abnormal result? The patient is notified for a follow-up appointment so the doctor can discuss the results of the test. So now we're talking about 3 steps involved in processing a laboratory test. And you'll see these on your lab worksheets. So the three phases are your pre-analytical, your analytical, and post-analytical. Things to remember is pre-analytical is everything that happens before that test is performed. Okay? And it goes all the way from your requisitions filled out, all the way to drawing that blood, all the way to transporting to the office laboratory or to the reference lab. The analytical part is in-office laboratory tests performed and results documented in a report form, right? And then post-analytical is specimens properly disposed of, patient's test results are interpreted and signed and dated, and then the patient is notified if results are abnormal. And then final signing off on the chart and make sure everything is charted and filled out properly. So a woman comes into the clinic where you work. Dr. Brown wants to order a pregnancy test. And remember, guys, these critical thinking and higher learner activities are very important because you're seeing that the things that you're learning, you can apply them in the work setting. So, in which phase of laboratory testing would the specimen be collected? Pre-analytical, right? That's everything that's done before you actually perform that test, right? In which phase would the test be performed? That's the analytical phase, right? And in which phase would you give the test results to the doctor for review? The post-analytical. So guys, make sure you're going through these and filling out your reviews. So these are basic laboratory measurements that you'll need to know. You can pause this and go over this. A lot of you, this will be review for you. Again, you can pause this, make sure that you're filling out your review guide, and you can go over these. Remember, we use military time. So if you're not used to that, which a lot of you probably already are because you've taken this in other classes and you understand when we're in that laboratory setting, in that hospital patient lab setting, they use military time. So you may want to practice that and make sure you understand how that goes. Also, some common temperature is used in the lab because we have to check and make sure that that refrigerator temperature is at the proper temperature. It falls within a range, and you will typically have a log that you will record these temperatures daily so that you can show that these temperatures were always in line from your refrigerator, anything that's frozen, anything that's kept at room temperature, and if you have an incubator in your physician's office lab, that it is always at body temperature. So you're going to have to name and describe 3 areas of potential hazards in the laboratory. You have biohazards, you have chemical hazards, and physical hazards. So remember, you want to know what those biohazards are, right? We have those biohazard containers. Anything that's got blood or any other body fluid on it needs to be tossed into that biohazard container, right? And we need to realize that before we bleach our counters, when you come into lab, before you bleach your counters, which we will be bleaching before we start and when we leave, but you will have your gloves on. Okay, and you always want to make sure you understand any chemicals and the hazards and precautions you need to take with using them. And then we have to understand about physical hazards, right? When we're in that labs, we'll have to have distance between each student. But there's stuff where spills can happen on a floor, make it wet. You could harm yourself. Or if any kind of cord is frayed on something like a microscope, you want to make somebody aware of that so we can replace that cord, decreases the chances of hurting you or causing some type of fire. So we're talking about the parts of the chain of infection, right? And this is where we want to break this, right? We do not want this chain of infection completed. So make sure you pause this slide. Make sure you go over this. You want to understand that it starts at that reservoir host, and that's that individual that has that infectious disease, and it goes all the way down to that susceptible host is a patient who lacks resistance. Whether your immunity is down because you're run down or you're in the hospital and you're already sick with something else, and those patients that are high susceptible to getting another infection. So make sure you understand how this works and the portal of exit, the mode of transportation, the portal of entry. Make sure you understand it. So talking about the CDC, standard precautions for infection control. So what is the primary factor in or the best way to break the chain of infection and prevent the spread of infection? Proper hand hygiene, right? We need to make sure we wash our hands. You wash your hands before you put your gloves on. You wash your hands after you take your gloves off. Hand washing, hand washing, hand washing. Can't say it enough. Okay, so here is personal protective equipment. You think if you put it on yourself, you put your goggles on, you put your gloves on, you put your lab coat on, right? These are some things. So you want to be able to identify the pieces of protective equipment. So pause this and make sure you're able to identify each one of these pieces of equipment. Okay, so what are the proper way to remove your gloves? Okay, read over this, but we will go over this in lab. So pause this, make sure you read over it, and then we will go over it in lab. So what is the difference between standard precaution and universal precautions? This is one of those things that's just hard to get it in line. And some of the key things that you need to remember is standard precautions are recommended by the CDC. Universal precaution is under OSHA, right? So standard precautions are set up to prevent the spread of infection in healthcare settings, right? And it includes the recording, monitoring, and the evaluations of policies to protect healthcare workers from being exposed to blood and body fluids, okay? And then universal precautions, like we talked about, is under OSHA. And it's the assumption that all blood and body fluids from any patient, whether it's your 90-year-old neighbor or a 2-week-old baby, or even a test kit that you're using, could possibly be infectious, and we need to treat them accordingly. So here's some of our governmental agencies when we're talking about biohazard training and bloodborne pathogen standards, okay? And you need to understand that the standard precautions fall under the CDC, right? Center for Disease Control and Prevention, right? And that OSHA is under the Department of Labor. We need to understand that the policy developed by OSHA to protect healthcare workers who are exposed to blood and body fluids is the bloodborne pathogen standard. These are two things that are really hard to learn, so you guys make sure you pause this and understand the key differences between standard precautions and universal precautions. So which set of precautions include the recording, monitoring, and evaluations of policies to protect healthcare workers from being exposed to blood and body fluids? Okay, so this is just a little slide to help you remember. So still staying on this biohazard training of bloodborne pathogens, right? So OSHA regulations require all healthcare facilities to develop what plan to minimize healthcare workers' exposure to bloodborne pathogens. You have to have an exposure control plan. And that plan has to include written job categories for each employee and what their risk is. You have to have hepatitis B vaccination guidelines and records for each one of your employees that are at risk. You have to have record of universal standard training for bloodborne pathogens for each employee, depending on their risk. You have to have implementation of safe work practices, and you have documentation of annual safety training for your employees. So what are 3 bloodborne pathogens that pose the greatest threat to healthcare workers? You have HIV, HBV, and HCV. And remember, that's hepatitis B and hepatitis C, right? HBV and HCV are both infections of the liver. okay? So now we're talking about some preventative measures, right? You want to get your HPV vaccine. That's a preventative measure. If you're vaccinated against that hepatitis B virus, that means it lessens the chance that you will come in contact it. We have engineering controls. These are just things, devices, equipment that makes the workplace safer, whether that's sharps containers. We have safety devices for needles, all kinds of stuff, and we'll go over all these in the lab, and you will have hands-on training with this. And then there's the use of work practice controls. These are rules that make the workplace safer. So engineering controls are devices that make it safer, and work practice controls are rules that make it safer. Look at all these things, right? You want to know the difference between the engineering controls and the work practice controls, right? Sharps containers, biohazard box, safety devices on needles. Remember, these are all engineering controls. Having a rule that says do not store food in the refrigerators containing test kits or blood is a work practice control. So how are biological waste containers marked, right? Because we need to know, and we're going to go over these in the lab. You're going to see them. It's going to be on your review study guides and in your textbook. With the color red or orange and the biohazard symbol, right? So our sharps container, our biohazard container, they will be red and they will have the biohazard symbol on them. So when and how should laboratory counters be disinfected? And we're actually going to do this in our face-to-face labs. Lab counters should be disinfected at the beginning and the end of each shift with a 1 to 10 or 10% bleach solution, which must be prepared daily unless you're using one that keeps them separate and squirts them out together at the same time. You will always be gloved. You will wash your hands before you put your gloves on, and you will have your lab coat on before you use your bleach. So what is the most important factor in laboratory safety? The healthcare workers committed to safety. If you're not committed to following the rules and regulations, if you're not committed to making sure that you pay attention, you do the things the way you're supposed to do, the safety program does not have to be, that will not work. So you have to be committed to the safety. And as we all see, there's lots of diseases out there that can hurt us, and we want to make sure we're protecting ourselves, our co-workers, our patients, and our patients' family by sticking to those rules and regulations to a T. So remember, these questions are back there. How often does a 10% bleach have to be made up if it's mixed up ahead of time? Okay? So you go to work as a new medical assistant in Dr. Brown's office. You're looking for a place to dispose of some bloody galls. How would you identify the correct container for disposing of the galls correctly? Read through these, pause it, and make sure that you can answer each one of these questions correctly. So, what procedure should be followed if a healthcare worker has an exposure incident? What does that mean? That means they have been exposed to blood, such as a needle stick. There's also other ways that you can be exposed, whether something splashes into your eyes or into any other mucous membranes. First thing you want to do is wash off the exposed area immediately with something like alcohol or iodine. You want to report that incident to the supervisor, and you will fill out an incident report. Then you will immediately seek medical attention and being post-exposure prophylaxis ASAP, okay? So just remember the process. The first thing a lot of people like to do is squeeze that finger and let blood come out. If you get stuck with a needle, then wash it immediately. then you immediately go and report it to your supervisor. You and your supervisor will fill out your incident report. Then you will be sent somewhere, whether it's an off-site work care facility, down to an emergency room, somewhere, so that you can seek medical attention and be given any post-exposure prophylaxis that you may need. We will also be filling out a exposure form in our class so we can learn how to fill this out. And it's very important that you follow each and one of these steps. So you want to name each one of these for your hepatitis B, hepatitis C, and HIV. So you'll have an exposure report form in your workbook. It's in one of these pages. We'll go over it too. We'll get the exact one in lab when we meet on Monday, make sure that we have it. And you'll take that home for homework after lab, and you will fill out the form using your lab partner's name that you meet in lab. So this homework activity will not be able to be done until you meet that first day in lab, okay? And we'll go over it in there. So talking about clinical chemical hazard training, hazard communication standard, right? Besides blood and body fluids, healthcare workers must be aware of the dangerous chemicals that they may encounter in the lab. Workers should have an orientation, which we will have in our lab, before handling any hazardous chemicals, even bleach. And you will get a tour of your laboratory, and you will know about your safety equipment. So what federal agencies regulate the HAZCOM communication standard, or, as people refer to it, the right to know law? That's OSHA. You have a right to know about the chemicals that you are dealing with in your job, no matter where you work, including our face-to-face lab. So you want to name the 4 types of chemical hazards, right? We have dangerous acids and bases, we have inhalants, and one of the most common one is bleach, and that is a chemical, and it can be dangerous. So you have safety data sheets. We kind of more refer to them as safety data sheets now, or material safety data sheets. We will go over the ones that we have at BIPSI, and I will go over them and show you exactly how they work. Just remember those chemical hazard inventory sheets that by law must be kept by the employer. And they're usually in some type of notebook, and they're made available to all employees. So talking about chemical labels on bottles and MSDS sheets should be read prior to the use, okay? And these are some of the information that's going to be listed on that safety data sheet. The things you need to make sure that you understand is the possible hazards for that chemical are going to be listed on there, and any first aid you need for that list is going to be over there. And you need to know that before you start using that particular chemical. So we're talking about the labeling of hazardous chemicals. So there's different systems for labeling. You have the NPCA and you have the HMIS. And we're going to make sure we understand what these labels tell us. So you have blue is your health hazard, red is your fire hazard, white is a specific hazard, and it also will tell you the PPE you need to be wearing when dealing with this chemical, because it can vary from chemical to chemical. And then yellow would be the reactivity. As I said, you will have your lab coat on and your gloves on before you bleach your counters each day before you start your lab and once the lab ends. But you will need to know what each one of these colors stand for. So start studying this now. So still talking about chemical hazard training. So again, we talked about this. Blue, right? Health hazards. Code blue, that might help you understand. I know all of you have watched Grey's Anatomy or one of the other shows that deals with health, that deals with hospitals. Then that yellow, we talked about reactivity, right? If it's how unstable it is. Red is how your fire hazard, is it flammable? And white is other stuff such as which PPE you need to use when dealing with this chemical. So I'm going to go through these slides pretty quickly, right? Because these are some review slides that will really help you nail down the questions that you may be asked. These are things that not only you need to know to be good at your job, but to be successful in this class. So I'm going to click through them quickly, but you can pause them and test yourself with them. So this will be your homework, okay? And these will be on those review sheets that you will have, that you'll be in front of you. If you need to print out chapter 1 before this, you can do so. Otherwise, I will hand it out in lab, and you'll be able to sit down with that chapter 1 review sheet, go through these slides, fill out the answers in those review sheets, including this homework section, and then study those, and then you will be successful on your test. So make sure when you're filling this out on your homework, these are some key things you need to include and make sure that you understand. Okay, so physical hazards. Okay, we went over biohazards, we went over chemical hazards, and now we're going over physical hazards. Okay, what should you do to ensure safety for physical hazards, right? We want to make sure that all equipment's always grounded, right? We run drills, whether that's fire drills, any type of safety drills. You want to make sure you lift properly and you understand how to lift properly, okay? You want to keep your hair tied back so that it doesn't get down and get stuff in it, right? And when we talk about trash, first of all, you always want to think before you toss, okay? Think before you toss. Having said that, you never want to take your hand, even with a glove on, and push down on a trash can. Why? Why? Because someone could have not thought before they tossed a needle into the regular trash. Sadly, it's happened before. You stick your hand down and to go to push down on the trash, a dirty needle sticks you in the hand. So never do that, okay? So talking about physical hazard training, okay? What is the proper sequence of donning and removing PPE? Donning, right? When you don something and you put it on, okay? You put your gown on first, then your mask, you've already washed your hands, then your gloves, right? When you're doffing or removing it, okay, you take your gloves off first, which we will teach you the proper way to do that. We talked about that earlier. Then you take your mask off, then you take your gown off. And we'll show you the proper way in doing that, okay? That's the sequence, and then there's a proper technique for doing that. So there's different kinds of glove, right? Because we have people who are allergic to latex, so then they will need to use an alternative like nitrile or vinyl or something like that. And then we'll also talk about sterile gloves that are usually used in just certain situations, such as surgery. And we'll also show you an example of each and every PPE out there and all those equipment that are used to keep you safe, right? So healthcare workers cannot disclose any information to a third party without signed consent. This includes insurance companies, attorneys, and curious neighbors. And it includes acknowledging whether or not the person in question is a patient. So we want to make sure we understand HIPAA, right? HIPAA is talking about disclosing knowledge about that person's health records, right? Healthcare workers cannot decide confidentiality based on whether or not he or she approves or disagrees with the views or morals of that patient. Even if you may not care for your patient, maybe you don't agree with some things that they have done, it doesn't matter. You still have to stick to confidentiality. It's the law. Healthcare workers cannot reveal not just medical information, but any financial information you might be aware of from your patients. Okay, so healthcare workers cannot use the patient's name when talking on the telephone where others might overhear or allow one patient to view another patient's information from the computer screen. So when you have patient's information pulled up on a computer screen, you want to be very careful about who is standing around when you're doing this, including any documentation you may have. This is why it is an absolute zero no to ever take pictures and post them on any social media while you're in any type of healthcare facility, Because as we now know, you could be taking a selfie of you and your friend at work, and there's information about another patient laying on that desk. Nowadays, you can zoom in on that picture and see it. It's an absolute no-no to do that. All right, so we read through each one of these and understand about answering machines or voicemails, okay? If you leave a message on someone's answer machine or voicemail, you just say, "This is Ms. Shepherd from Dr. O'Neill's office. Could you please call us at your convenience?" Okay? You never tell what you're calling about. You never leave lab results on someone's voicemail. So also, healthcare workers cannot leave medical charts or insurance reports where others can see them. And you cannot release privileged information if the patient is unwilling for it to be released. That's why you have to get forms signed. You have to make sure that the patient understands why and whom their medical records are being released to, and they have to sign off agreeing. If you need to send medical records to an insurance company so that they will pay for a certain procedure, you have to let the patient know, and they have to sign off on that, letting you send those as needed. So you want to be able to describe the process in compliance reporting of unsafe activities and incidents reports, right? We talked about this earlier. If you sustain any type of injury, you need to report it to your manager or supervisor, and an incident report must be filled out immediately. So in this chapter, we talked about the reasons laboratory tests are ordered and how specimens are analyzed, the necessary attributes required of a laboratory professional, using requisitions with proper documentation and confidentiality. We talked about applying those CDC standard precautions for infection control and proper hand hygiene. We talked about OSHA's regulations regarding the bloodborne pathogen standard and hazard communications program, proper disposal of biohazard waste, think before you toss, the proper action to take after an exposure incident, got to fill out that incident report it to our manager, right? Safety rules that must be observed in the laboratory, and proper donning and doffing or removal of your gloves and other PPE, right? So I am going to quickly go through these review slides. I'm putting these up here as a way to help you not only fill out your review guide that you will have for each chapter, but as a way for you to use this as a tool to study. So let's go through these few slides on some reviews of some key terms and abbreviation. So make sure you know what your homework assignment is for lecture. What's your homework assignment for lab? When is your first test? Look through that tentative course calendar and just move that finger over to the left once you see test 1 and you'll understand. So what should you study for your test? You're going to read your chapters, right? And you're going to study those review guides for chapters 1 and 2, right? What goes in the white lab binder? That's going to be something that's handed out to you, right? What are you turning on for a grade? Make sure you know this. We'll go over it in lab as well. What goes in the black binder? That's going to be those chapter reviews that I'm going to hand out to you, and then you're going to put them in order, and during your first test, you're going to turn it in for a grade. What are you turning in for a grade? That and your worksheets that we'll go over in lab. If you have any questions on these slides, please reach out to me. Okay, I'm available. You can text me, you can email me. And a lot of this stuff, when we have our face-to-face lab, we're going to answer some questions and we're going to go over this stuff as well. So you guys have a good day. Make sure you go over these. Thanks a lot.